welcome to another episode of Healthcare in India. I'm Sukant Khurana. With me is my co-founder Ramesh Gauri Raghavan from InCure. With us today is Dr. Sharat Krishnaswamy. He's an anesthesiologist and a science communicator based out of Bangalore. We also have with us Dipashri Konar. Dr. Dipashri Konar is a microbiologist, epidemiologist, and a physician who's trained both in India and in the US. So Dipashri in previous episodes discussed with us the challenges in Chhattisgarh, and she nicely laid out how it is, how healthcare is not just a health problem, it's a social economic problem. So given that she has given us perspective of Chhattisgarh, I would like Dipashri to ask Sharat how the situation is in Bangalore so we can sort of better understand the contrasts.
Hi, Sharat.
Hello, good evening.
Good evening. So it seems you work in a setup which is very different to mine. And from a doctor working in a metropolitan city, your views or what you're seeing will be somewhat similar to mine, but somewhat different too. So why don't you discuss the similarities and the differences so that we get a wholesome view on what's going on in a diametrically opposite part of India?
Yes. You mentioned about what are the similarities and dissimilarities. I would like to focus on the dissimilarities first. Basically, we are talking about resources and infrastructure. Whether you have a lab, whether you have the equipment, whether the equipment is working, whether you have personnel that is educated enough to manage the cases that is coming in and the specimens that are coming in, and a supply chain. Once you have a supply chain, it is easier to fast forward the process. You are working in a rural area right now, and the challenges that you have mentioned are very relevant. Nutrition is extremely relevant. First, to fight diseases, to improve immunity, to improve the enzymatic processes in the body, and all of this is less of a challenge because you have greater access to medicines, greater access to food and healthcare as compared to a very far-flung area. When you're coming to the similarities, I think it is trying to understand the disease, the process of evolution of the disease, because such a pandemic has not affected the world in such a moment where information is very easily accessible. The kind of challenges that we doctors and medical health professionals face right now is the infodemic. You have so many studies coming from so many different countries and villages and cities and research institutes that to identify what is relevant and what is important takes a very long time. You might have one paper right now which gives you adequate information, but the next day you have a different paper contradicting the previous day's claim. So you're in a crossroads as to find out what is actually important and what is not. Initially, since this is an evolving infection, the city itself had a lot of challenges. They initially began to have COVID designated hospitals and non-COVID designated hospitals. And each patient or any attender that comes to the hospital had to go through a screening process. Has the person come in contact with a COVID patient? Has the patient had travel to a city which had a greater number of COVID cases? Does the patient have symptoms such as shortness of breath and fever and so on? The thing is, even if they are asymptomatic and they're not showing signs of infection, once they get admitted and they develop a fever, that is when you decide whether you have to test the patient or not. And in the process, the patient could have infected a lot of people around him, as well as the medical health professional also. Understanding that, medical health professionals are also a critical area in this parameters, because once you don't have enough medical professionals, then you won't have people to treat the patient. So it will snowball a domino effect. So these are the challenges that we face in city.
So, Sharat, as an anesthesiologist, you are one of the people at highest risk, even among medical professionals, because you're exposed to aerosols, which is the primary mode of transport. So, what do you have to say about that? Like, how is it, affecting you professionally and personally? And also I would say, like, what are the changes that you have seen, you have made to accommodate for this extra risk?
So, of course, mental health is very it's of prime importance, especially for all us healthcare workers, because our attitudes towards the patient is a reflection of our attitude towards ourselves. Only when we have peace of mind and we can work properly, being affected by anything. Coming is the PPEs are suffocating. You have to take in deeper amount of breaths. You have to, struggle with the equipment, and to actually give care to the patient is a problem. And you deal with anxiety because what are the chances of you, contracting infection? What are the chances of you giving out the infection to the other people? So the measures that I am taking are, this is we're all in it together. I mean, all of us are facing equal risk. It can be somebody who's not connected to what is happening, to somebody who's right in the battlefield dealing with patients. Anybody can get affected. So there's no point losing your head upon. Just go ahead and face it and see what happens. I think that's the kind of attitude that all of us have. And as for me, I try to limit as much interaction as possible, wear masks everywhere I go, and don't spend too much time in social, or in socializing with many people, and try to find my ways to get adequate sleep and get back to work as usual. So that's how it is.
So for those who are not aware, wearing a PPE in the Indian temperature, it's a punishment like going to hell. So, I mean, the doctors and the healthcare workers who are wearing it, and I mean, in places like ours where there is no air conditioning, you're working, in a, like, it's like working inside boiling water. It's so hot. Okay.
Yes.
Yeah. Coming.
So, yes.
So that's
coming back
right?
to, yes.
So Sharath will not be having to face that. He will have the other hell of central air conditioning, which will be spreading the virus even more, right?
Yes,
so
yes.
it's like a ditch on one side and a quarry on another. So,
Yes. Exactly, yes. So there are pros and cons of everything, but my heart goes out to somebody working in very hot atmospheres, because to actually think clearly in a very hot environment is very difficult. So yeah, in that way, we are not in it together. We all have different challenges individually.
We are in the same storm, but we are riding on different boats.
Yes, that's a good way of saying it.
Good way of putting it, yeah.
So, Sharath, if I may ask you, are you taking hydroxychloroquine?
No, actually, according to the different guidelines given by different health agencies, when we look at guidelines, they could either come from the European, they could come from UK, they could come from Australia, or they could come from the the United States. And looking at all of this, we also judge how they have got the data and what their scientific process is to come down to a particular conclusion. And we've noticed that the treatment methodologies differ in different places. Of course, the outcome is positive, but then how would you actually base your outcome on? Is the scientific process valid? So far we have seen that the UK would not introduce a drug unless it undergoes all the 4 phases, the phase 1, phase 2, phase 3, and phase 4. And it is definitely, we as medical health professionals, we would not like to prescribe a drug without understanding the absolute side effects of it. Everything has to be seen as a risk-benefit ratio and other pros and cons in any medication. If a particular drug can cause you to develop side effects within 5 minutes, then I would not advise you to, to take it. So that's my take on. I haven't taken hydroxychloroquine personally, and I wouldn't advise anybody to take it yet.
So an equally interesting hot button issue. Today there was a news of Panchgavya being tested scientifically. So if people who don't know Panchgavya, it has several things from cow. I think milk, butter, ghee, dung, and urine. So I think things can be worse than hydroxychloroquine, and they might be more promoted. So
I could bring in a
Put
very
them.
different perspective in Mumbai, you know. So we see a huge rise in malarial cases once the monsoon sets in.
Yeah.
And if we are short of hydroxychloroquine, we have another epidemic on our hands.
So absolutely, there are several epidemics actually in making. So, and they'll depend on the crisis, depending on the city and whatnot. So, but there are going to be several things because number one, what is going to happen in this case, much more globally. Let's talk of the pan-India context because vaccination drives are on a stop, and they will not happen for next 3-4 months. It may even be worse. So even measles will be up on the rise, right? So now the supply chains are broken. Supply chains are broken. Somebody gets bit by a dog, you'll have even higher incidences of rabies. Now you have lower spray. So you have less pesticides for mosquitoes. So you'll have higher amount of vector-borne diseases, right? Such as malaria. Then there are even changes in habitat balance, right? Because now you are not even cutting down trees, right? I'm not suggesting you cut down, but the management changes. So most of these vectors of these mosquitoes, right? These vector-borne diseases, both the genders do not consume blood, just like female Anopheles versus male Anopheles. So that balance is altered. So you expect other things. Now, hospital overload will create more MDR strains, right? You have more patients stuck in the same place. So you're going to have more antimicrobial resistance, multiple drug resistance. So you're going to have issues of AMR, MDR. You're also going to have latent viruses because you have patients dying next to each other with compromised immunity. A huge chunk of our genome is latent viruses, right? So they are now under spread. Now, we have already discussed issues of layoffs, poverty, and whatnot, but there's going to be a huge spike in mental health, right? And
yes, so that's
you know,
we are facing. So it's interesting
there
to
are
France,
several.
but we are now running out of time. And
Yeah, so we need to wrap up. But essentially, to summarize, I think it's not one pandemic, right? So one pandemic results in several other pandemics. So this was, I think, highly informative to see the differences between what Sharath is facing in Bangalore versus Dipashri is facing in Chhattisgarh.
yes,
So we'll return back with more experts and different issues related to COVID-19 pandemic in the next episode.
yeah. Thank you so much, everyone.
Thank
Thank
you.
you.
Thank you,
Bye-bye.
Sharath. Thank you, Dipashri.
Thank you.
Thank you.
Thank you.